What do cervical cancer stages mean for your treatment? Imagine your body as a map and cancer as a traveler that has moved through different territories. Knowing exactly where it has gone helps doctors decide the best way to stop it. That's what staging cervical cancer is all about. It describes how far the cancer has spread, which directly influences the treatment options available. Cervical cancer is classified into stages from 0 to 4. Early stages like 0, 1, and some parts of 2 mean the cancer is mostly confined to the cervix or has only spread minimally nearby. In these cases, surgery is often the main approach. Doctors might perform procedures like removing the uterus and surrounding tissues, or in some cases, they might do fertility-preserving surgeries for women who want to keep their ability to have children. For very early cancers, less invasive options like a cone biopsy or a large loop excision can sometimes remove the cancer completely. When the cancer reaches locally advanced stages, such as 2, 3, or 4, it has spread beyond the cervix into nearby tissues but hasn't reached distant parts of the body yet. Treatment at this stage usually involves a combination of radiation therapy and chemotherapy. Radiation can be delivered externally or internally, and chemotherapy drugs like cisplatin are used to make the radiation more effective. Sometimes, immunotherapy drugs may be added for more aggressive cases. Surgery is less common here but might still be considered in certain situations, often followed by radiation and chemotherapy. If the cancer reaches stage 4, it means it has spread to distant organs like the lungs or liver. This is called metastatic cancer. At this point, the goal shifts from trying to cure the disease to controlling symptoms and prolonging life. Treatments often include chemotherapy, sometimes combined with immunotherapy or targeted therapies to slow the cancer's growth. Palliative care becomes very important to help manage pain or other symptoms, and procedures like radiation or surgery may be used to relieving blockages or discomfort. It's important to remember that each person's situation is unique. Factors like age, overall health, and whether they want to preserve fertility influence treatment choices. Doctors also consider the specific characteristics of the tumor, such as its size and whether it has invaded nearby tissues. Clinical trials may offer access to new therapies, and discussing these options with your healthcare team can be helpful. In summary, the stage of cervical cancer guides the treatment plan. Early stages often involve surgery and possibly radiation, while more advanced stages relying heavily on chemoradiation. When cancer has spread to distant organs, treatment focuses on systemic therapies to control the disease and improve quality of life. Always consult with healthcare professionals to develop a personalized plan that considers your individual health and goals.